Well, thank you very much for having me and for the beautiful and warm introduction. I really value you and what you contribute to the field, what you contribute to ACBS. I think it's difficult to even understand, you know, for uh, most of the community in North America, the extent of your influence and the influence of this community and how important the work you're doing is. It's profound. So it's humbling to be here with everyone. Now, I just want to check on one small technical detail. I've had more experience with um, consecutive translation than simultaneous translation. So far, I don't need to pause yet, or it's just Paulina, who I also want to thank very much, is doing just great job. And is it okay?
You don't need to pause.
Good. Okay. Thank you so much. I just wanted to make sure, you know. So this is aiming to be an informal discussion about some pretty important and pretty serious things that might even be more serious. Doesn't mean they can't be fun, but things that might be more serious than they seem at first, which is, how do we practice mindfulness, acceptance, and compassion in our work as clinicians in an evidence-based way and in an effective way during an extremely challenging period in our history. I always hesitate this year when I say an extremely challenging period in our history, because I've treated so many people who have a trauma history or who are currently going through difficult experiences, and we all treat people who might face economic challenges or addictions or depression. In our work as psychotherapists, it's almost always a very serious and difficult time in the lives of the people with whom we work, isn't it? I mean, 2020 is sort of the norm for a lot of our clients on some level. So I always find it hard this year, to respect and honor how hard it has already been for so many people and for parts of ourselves. And then also recognize that this is a much harder year. And the people who are already facing hardship, emotional, psychological, economic hardship, this year has hit them even, or some, harder than it's hit other folks. So what a year that we are all facing. And it also presents us with a unique challenge, which is our clients don't always know the extent and nature of our suffering and our stress and our fears. Even if you do FAP, functional analytic psychotherapy, or this ACT, or you're very experiential and you're very self-disclosing on some level, there's still a distance, appropriately, because the clients are not there to talk about us. They're there to talk about themselves. But this is sort of different this year, because they know something. And and look, how many of us we've been clients, we've been patients, we've been therapists, right? Okay, so I don't even do the us and them too much. But the people, your clients, know something about you. They know you're going through something strange and frightening and challenging. And that presents a unique opportunity, I think, in terms of working with compassion and mindfulness and authenticity. It also presents some challenges, because we're in pain in a way, and exposed in our pain in a way that we aren't always. So I think working with an deliberately compassion-focused method has been very helpful to me, to our team, and I think it can be helpful to you. And many of you are already doing this, but those of you who haven't deliberately focused on compassion as a specific process to target in therapy, I guess that's part of my aim for this evening, is to suggest that in addition to the compassion you bring, in addition to the fact that you are already compassionate, you already understand compassion, that we can deliberately awaken and cultivate compassion for others and compassion for ourselves in evidence-based ways, and that can lead us to greater psychological flexibility and to greater possibility in what we're doing, you know? So when we say this, we don't just mean compassion as an idea or an attitude or a value or a thought or a concept, but compassion as an embodied motive. When you learn compassion-focused therapy and train in it and train in compassion-focused therapy and ACT, we appreciate that human beings have evolved in such a way that from the moment we're born until the moment we die, the presence of our sensitivity to the suffering of others and ourselves, blended with our commitment to take action, to do something about that suffering, that warm, connected mode of operating, that way of being, affects our health on every level. It affects us in our immune system, in our heart rate variability, in our levels of anxiety and stress and depression. And all of the great world religions and philosophies have known this for a very, very long time. And all of the great educational systems that have really, really helped people, and systems of psychotherapy, have been aware of this. And what I love about this period in the history of therapy and psychology and inner work is that we can share methods and research that allow us to do this work together, that allow us to build this capacity very deliberately and very on purpose. And if it is okay with Manuela and with everyone here, I would like to structure our meeting tonight a little bit differently than what I had intended. I am more than certain that once we are talking together, that the essential points from compassion-focused therapy will come forward. But I'm feeling a deep sense of what is necessary for our meeting, and I want to honor that and trust that, and be way too dramatic about it, by the way, but I'll live, you know. I would like to ask if there are questions, and I just would like to spend this time responding to whatever questions people might have about compassion-focused therapy, about ACT and compassion, about psychotherapy. And I would like to offer you anything I can during our time together. And the best way to know what it is that would be the best thing to offer is to just invite you to ask. So if it would be okay, is that okay, Manuela, to proceed in that fashion?
Perfect.
Okay, very good. So perhaps then Paulina could, or you could, read or just let me know what the question is, and we could either use people unmuting or the chat box, depending on whatever works best for your system and in this wonderful group here on Zoom.
Si quieren hacer una pregunta, pueden hacerla en español y Paulina la traduce en inglés para Denis. Así que simplemente se abren el micrófono, levantan la mano virtual y una vez que los nombro, hablen el micrófono y hacen la pregunta. Hay alguien preguntando, Gladys Settle, ¿a qué se refiere con evidencia? En el
That's
chat.
a really meaningful question, and it's a tricky one in a way. The term can mean different things to different people, and it can have inadvertent consequences as well, right? So, for me, an evidence-based approach to therapy means that the processes and the procedures and the overall package of the psychotherapy have had supporting research, you know. So when we look at compassion as a process, we can look at the evidence base for compassion focused therapy. And there are, I guess, about 14 studies that are different outcome studies that indicate, a good effect size. That, and they're not all randomized, they're not all completely RCT oriented. But there are a few RCTs and a few other good outcome studies. There are also outcome studies and process research on the use of compassion training, compassion imagery in the treatment of trauma, compassion imagery in conjunction with mindfulness interventions. There is neuroimaging research which looks at the effect on the brain in terms of function and also in terms of neural integration and structural changes that occur when people are practicing compassion imagery. There's research about the effects on the body, effects specifically a lot of research on heart rate variability and on immune system functioning. There's good research involving the polyvagal complex. There's good research involving oxytocin vasopressin system. So in the biological basic science and neurophysiological basic science, there's good supporting research. And there's useful dismantling studies and process research and the whole wealth of research around self-compassion and all of Kristen Neff's, like the 1,800 studies supporting self-compassion. And I could go on and on. But we don't have, with compassion and CFT and compassion and ACT, we don't have like what we used to have in the 90s and the 2000s with CBT, where it's like randomized controlled trials, this package versus that package. We have, but in some ways, we have a more expansive scope of evidence. If we extend that out into the attachment literature, if we extend that out into the relationship between attachment and psychological flexibility, if we extend that out into the mindfulness literature, and even since a lot of us are working with ACT as well as compassion and CFT, if we look at all of the research supporting ACT, and we look at the processes of mindfulness, acceptance, and compassion, mindfulness, acceptance, and compassion, and we guide our interventions along those ways, we have all of that scientific research. And now I'm going to show you, here's a magic trick. And the magic trick is I'm going to demonstrate something that you already know. And that's that there's implicit bias and racism in just about everything from the Western world, which is a racist term. Particularly a North American white male will have to have some sort of ridiculous bias, like baked into my noodle in some way. And this is the racist bias, which has really agitated me for many, many years. And I would say it's not really my bias so much, but it is a bias of our academic institutions. In a way, it's a pro-science bias, which I don't mind being pro-science, but it is also an anti-subjective, an anti-cross-cultural, and how else could I say it? To some extent, like ignoring the contribution of indigenous cultures, in that there are thousands of years of extensive scholarship and systematic thinking and countless descriptions of the benefit of mindfulness, compassion, and acceptance training in Vedanta, in esoteric Christianity, in Sufism, in esoteric Judaism and Kabbalah, in indigenous people's practices, and in, most notably, as it's come to the West, in all of the vehicles of Buddhism, Theravada, Mahayana, and Vajrayana. And this has reshaped the face of the world for thousands of years, much longer than the modern era. So I could sort of say, here's the research, here's the evidence, but the evidence is very deep, and the evidence is as old as there has been a culture. Also, the most important piece of evidence, in a sense, is your experience, is your being an N of one, subjective, applied neuroscience, applied phenomenology of your own compassion training, right? So I told you I would go on and on with these answers, just ask a question. I want to respect and integrate all of those levels of evidence, and not just think of evidence-based being like, because some people in a university did an 8-week trial of MBCT, that's the evidence for mindfulness, rather than several thousands of years of human experience. But it is still, science is important. So that's how I take these things. So what other questions might we have?
Great. There's a question in the chat. I'm going to translate it into Spanish. It is written in English. ¿Cuál es tu definición técnica de compasión? ¿Cuál es la definición de autocompasión que le das a tus pacientes cuando te lo preguntan en sesión?
Okay, I'm very fond of the compassion definition we use in CFT, which is very close to the traditional definition of compassion that you can find in Buddhism, but also in like the dictionary, and that is a sensitivity to the presence of suffering in yourself and others, combined with a dedication and a commitment to take action for the prevention and alleviation of that suffering. Paul Gilbert likes to say, to be helpful and not harmful is the shorter version of that, right? But that's the definition. It doesn't mean being nice. It doesn't mean being kind. It doesn't mean being friendly, although those are often part of it. It doesn't mean being protective or being courageous or being playful, although those are often part of it. It means a sensitivity to suffering and a willingness and a commitment to do something about it. That cuts through a lot of the problems with compassion that come up for clients. And very often when people are like, well, can you be too compassionate? Can you be too sensitive to the presence of suffering and too willing and prepared to do something about it? I don't know. It doesn't mean you're soft or weak if you're being compassionate. When you're being sensitive, like a firefighter is sensitive and aware of, a surgeon in a trauma ward, a mother, a father, these are inherent qualities. And in CFT, we construe this compassion to be an evolved motive that is distributed through the human body. It's an actual part of, just like our reproductive system or our digestive system, like our motive to eat, our motive to have children, our motive to fall in love, our motive to protect ourselves, our motive to be compassionate is essential to our biology and to our humanity. So we view it as a biosocial goal, a motive that is embodied. And in this case, what Paul and the CFT community did was we just added the self or others piece. That was always implied in the definition of compassion. Paul made that, I should say, Paul, it wasn't we, I didn't do it. But, within our community, there's this piece which is self or others. So there isn't really a distinct difference between self-compassion and other compassion. And as a Zen, practitioner, the self is a sort of a kind of a tricky, slippery slope, the same as in RFT, right? So now Kristen Neff, who's a good friend and remember was the arc of her whole developing her approach. She's done such extraordinary things with Chris Germer and others, and many of you have probably done the MSc training and things like that. She took a different kind of take based on, reading Tara Brach and Sharon and people like that, and her own, journey with meditation and Buddhism. And she identified these 3 elements of self-compassion in her definition. It's actually 6 elements because she contrasts the negative and positive, right? So it's, for Kristen, self-compassion is constituted by mindfulness, awareness of the present moment, contact with the present moment, non-judgmentally. And also, in addition to mindfulness, a sense of common humanity. And finally, kindness to yourself, self-kindness. And in the full-blown thing for her, it's like kindness as opposed to being cruel to yourself, a sense of common humanity as opposed to feeling isolated, and mindfulness as opposed to being over-identified with your cognitions. And in the self-compassion scale, in its different iterations, in numerous factor analysis kind of research, those are the factors that shake out those 6 factors. I don't tend to use that definition except when I do, like it's not the definition I begin with, but if we want to use the self-compassion scale, we bring it in. If we want to help someone really focus in on self-compassion, or if there's some things that Kristen's written or Chris Germer's written, sometimes we bring it in, but it's not the foundation definition that I tend to use, because I like this sensitivity and awareness of suffering, plus doing something about it. And it's also important as a behaviorist and as an evolutionary scientist to think it's kind of nice. All biosocial goals, all biosocial aims have 2 components in behaviorist informed science of evolutionary science. You don't really see this so much in David Sloan Wilson, but it's implied, right? So when people talk about motives or biosocial goals, they talk about 2 pieces. One is identifying a stimulus and distinguishing it from other irrelevant stimuli. And the second is having a behavioral repertoire to respond to that stimulus, right? So if I want to have dinner, right, I might notice many stimuli here. Okay, and I was going to say there's nothing that I could have at dinner, but there is one thing. So I need to be able to, I feel hunger, I have a motive. So if I see this is a candle, right? Even though it's in a jar, I need to be able to make the distinction that this is not dinner, or I will be dissatisfied. It is made of soy, but it still wouldn't do the trick. I could also notice that there is, and I didn't know I had this on my desk, so it's probably a sloppier desk outside of the camera. I'm just saying, right? Okay. So there's this little package of a granola bar, and there's like some water, So maybe if I'm stuck on a train somewhere where I'm traveling, and that's dinner, If times were hard, that'd be actually a really good dinner. That'd be a hell of a dinner, I mean, technically. So making that distinction, like, oh, I want to find a partner, and being able to distinguish, like, probably, like, that's a chair. I don't need to be, asking my chair out to dinner. Do you know what I mean? And that's a potential partner. That's a potential romantic partner. These are absurd examples, but the ability to distinguish between different stimuli that are relevant to an important, evolved aim, and then having a repertoire to respond. How do you protect others? How do you compete in a way that's effective with others? How do you prepare food? How do you look after one another, care for one another, be loving, be strong, be supportive, and be flexible? And to recognize these 2 dimensions of acceptance, right, processes, and commitment and behavior change processes, or the dialectic between acceptance and awareness, and behavior change, or being sensitive to suffering and having some action you're going to take, is very effective to me. I like to be aware. We call in CFT, we call these two psychologies: the psychology of engagement, which is awareness, noticing, distinguishing, and the psychology of commitment and dedication. And there are different processes. If we were doing a longer training, there are certain processes such as distress tolerance, sensitivity to suffering, flexible perspective taking in terms of emotion, sympathy, perspective taking in terms of cognition, empathy, non-judgment, very similar to hexaflex processes, right? That are in the psychology of engagement. And then we have skills, which are sort of more like some of the DBT skills, ways of thinking, ways of attending, that are also part of how we work. So we're cultivating an interacting array, if you will, of qualities of doing and being and skills and processes that show up when someone is motivated and organized by compassion. So that's the long definition with all of the different dimensions of it, and the distinction between self-compassion. So hopefully that, it's a beginning. What other questions should we move to?
Hay una pregunta que dice, ¿qué significa motivación encarnada cuando habla de compasión?
That's another good question. That's like one of my favorites. So hold on one moment, sorry. Boy, this is taking longer than I thought. I have to do it correctly, I guess. Huh. Strange. There we go. Very strange. What is embodied motivation? Kristen Neff tells me I should shut up about this. She says, nobody cares about an embodied motive. People want to understand it. Just tell them it's three things. It's mindfulness, it's, common humanity and being kind. And then they get it and then they can practice it. But Kristen I'm usually training therapists. You know what I mean? And I think for us, it's good to understand what's under the hood of, the car a little bit. It's good to know what's there. So here is an experiential way to describe this. Let's imagine that, you've got a new job interview, because you moved to a new town, right? You decided, I'm changing everything. I'm moving to a new city and I'm very excited about it. And then when you get to the city, all your stuff is in storage and you get to your new apartment and the hospital where you're going to work is closed, doesn't exist anymore. And you need to find work. And you're like, oh my God, what am I going to do? How am I going to? But you get a job interview. And you're like, okay, this might still work. And you get closed, you get your CV, you go to the job interview. And then you are waiting in the waiting room. And the person who's going to interview you comes out. And they're like this. They're like, hello, come on in. Look irritated and annoyed, and they're asking you questions, and you're feeling like they don't like me. How am I going to afford to stay in this town? I don't know what I'm going to do. Imagine what that would feel like in your body. Imagine the thoughts that would go through your mind. Imagine how under social threat, your attention would narrow to just survival. How your repertoires would narrow, how you might, your mouth might get dry, the physical sensation of it might be very, So your self-protection motive, your please don't vote me off the island motive would be embodied. It would be distributed through your whole being we say you will be organized on a variety of levels: your attentional functioning, your affective functioning, your imagery, your physical sensations would all be organized by this emotional response, which relates to a motive. Now let's imagine a different situation. We can get rid of that scary story, we get rid of it. We come to another story. So it's about a week before your birthday, and you've had a really good day. You helped quite a few people at your job, and you felt really appreciated. There's enough money in the bank, there's food in the refrigerator, your family's healthy, you listen to your favorite song on the way home, you're feeling good, and you open the door to the living room, and there's about 7 or 8 of your favorite people in the whole world. And they say surprise, but they don't scare you. They're not like, boo, surprise, they're just there, and they all have a warm look on them. Maybe they have like a favorite wine is there if you drink wine or something like that, or favorite beverage or whatever it is. They made your favorite food, this beautiful cake or pastry, and they'd sit you down and they give you a glass to drink, and they say, listen, we know it's a week before your birthday, but we wanted to tell you how much we love you, how much we appreciate you, so we prepared this party. And each one says about how you helped them and what you meant to them and how you changed their life for the better. And you feel loving, and you feel loved, and you feel safe. So think about what that feels like in your body, in your heart rate, in your posture, the thoughts that go through your mind, the behavioral urges you have. That motive to be loving and loved, to be caring and giving and receiving of care, that experience with social safeness is embodied. It affects you at every level, and your attention becomes broader, like Barbara Fredrickson talks about, and broaden and build, and your behavior repertoires become more available. They tend to be more pro-social, more connected, and you're more psychologically flexible. You're sort of in a more affiliative, caring and sharing mode, and that can help. That makes us stronger. And if you needed to protect those people, think about how much you would fight to protect them, not out of terror or rage, but out of, this is what I do. This is who I love. I'm getting choked up thinking about it, as they say. It makes me emotional to think about this quality. It's a very important quality, and it is embodied. It's not just in your head. It's like rhythm. As a musician, one of the things you learn is you keep music theory in your head, but you keep rhythm in your body. If you want something to speed up or go slower or go faster, or be in better time, you can't do it by 1 and a 2, and it doesn't happen. It has to be expressed in the body, in your heart rate, in your respiration, in tapping your foot, in moving your hands. Rhythm and compassion and emotion and these wonderful qualities that we have and motives are expressed in the body. And the more we can embody these qualities, the more effective they are in ourselves and in our clinical work. Marcela Matos and her team in Portugal have some wonderful research on embodiment and compassion, and embodying the compassion itself. And all of the mindfulness and compassion disciplines have had an embodiment component too, like even in contemplative psychologies and methods like yoga or Tai Chi or the Gurdjieff movements or Sufi, moving Mevlevi dancing or music, or even just the rituals in church, So what we're talking about is really becoming more fully who we wish to be, practicing being the version of ourselves that we need in our lives. So that's what an embodied motive is, which is why, even though Kristen says it's too complicated to yak on and babble like this, I like it, particularly when I'm working with, caregivers like yourselves. So other questions? These are very good questions.
Hay una pregunta de cómo abordaría CFT en pacientes con dolor crónico y enfermedades orgánicas.
I think there are two or three major ways that that is important. And one is helping people to be with their pain and to be with the physical experience of pain. You know, I was talking earlier today with teaching a little bit, and this is a very advanced idea, which doesn't mean it's very intelligent. And it doesn't mean you have to be like super, you know, Albert Einstein or whatever it is, or his wife who probably did all of his work anyway. Like, you don't have to be like, I'm not saying this is so advanced, but it's saying it's kind of like, it's an advanced thing to get your mind around. So all of these qualities that show up in the body, all of these experiences, they're pieces of the overall human experience. And true to Buddhist philosophy, when you split something into its parts, it ceases to sort of seem to exist as a whole or as something that is separate. And what we see in the research on advanced meditators, people who have done like really, really many thousands of hours, right, of like compassion meditation and mindfulness meditation, way more than most therapists or clients. It doesn't mean they're better people. It doesn't mean they're like walking on air. It just means they did this thing a lot, right? So what we find is advanced meditators, they have the ability to have the physical sensation processed in their brain. And it doesn't necessarily have to be interwoven with their appraisal and their cognition. And it doesn't necessarily trigger or is interwoven with the behavioral urge, right? So if I have someone who says, oh, I can't believe it, I had this problem, I had this argument with my boyfriend, and I don't know what's happening anymore. I'm triggered and I want to talk to my parents and they don't understand either. And I'm sick of everyone. I don't think anything matters and I'm overwhelmed. I can't take it. If we were to work with them slowly, methodically, I won't role play a whole session, but if you were bringing psychotherapeutic presence and a compassionate exchange together, right? And you got to drill down, okay, so what is it that is overwhelming? What is it? Your mind is telling you this is overwhelming. What is the experience? Oh, I just feel so full of grief. I just feel like shame and grief. Okay, shame and grief. Which one do you want to talk about? The grief, it's too much. Okay. You want to respect grief. It's a big thing. Where do you feel it? My throat. Like I can't speak. And in my eyes, my mouth, and I'm collapsing. Like, okay, what part of that is the hardest part for you to feel? What do you mean? What part? It's that I'm going to cry, like I have an impulse. Okay, describe it. An impulse and a tightness up through here. Okay, let's just be with that impulse and the tightness. Let's breathe with it, and let's just be really, say hello to that part of you. Let's be kind to it. And then you get to a place, it's very interesting. What's intolerable about it? Is it as terrible as like breaking your leg? No, maybe not. Is it as terrible as a migraine? Not even really. Is it as bad as throwing up or vomiting? No. Does that mean that it's meaningless? No. Grief can be very meaningful, right? So I don't want to. It's just a physical sensation. That's not what I want to do. But we can have this compassionate, patient, slow, aware inquiry into the reality of our being, into the reality of our experience. And we can create a gentle container around that experience, which is even a loving container. And we can recognize that the nature of our experience is that we are enough to contain it, that we're enough to contain it, particularly when we create the conditions in our bodies that we can contain it. Now, that extends to interesting places, because after a while, as many of you who've treated chronic pain know from treating it with ACT or CBT, is that we can do that with pain, actually. We can actually contain pain. Now, where we go with ACT is very important, is that you're doing your mindful, valued action. Like you're not just giving into the pain or the sadness, you're living a life of meaning and purpose and vitality. And this is extremely important. When we bring in compassion, we're actually finding the meaning in our looking after ourselves and caring for ourselves and caring for others, and in our loving connection to one another and to all things. We're kind of like, Paul Gilbert likes to laugh, like, well, when you do ACT, Dennis, you choose values, but in CFT, we already have a value we've chosen. We've chosen that we want to be helpful and not harmful. We want to be kind. And very importantly, we're not talking about avoiding pain. We're actually talking about turning towards it and sort of stepping into an intimate contact with the pain. So when you're working with health concerns, part of it is helping somebody to really create the necessary and sufficient conditions that actually allow us to contain and accept and tolerate pain. We know this. This is like a fact, right? Like when people are in a state of sensitive awareness and accepting awareness, and they have a compassionate orientation, it is much easier to bear pain and threat and tension and distress. It's a polyvagal complex, and our rest and digest and tend and befriend process are there, and they're available to us, and that results in better prefrontal modulation of pain and threat and anger, and that allows us to have more flexible responding. This is how it is. So in addition to that kind of work with compassion to facilitate acceptance and engagement, much like ACT, actually, we can use CFT to help people to healthy behaviors, to actually specifically looking after themselves, to taking the medication that they need to take, to amending their diet as they need to amend it, to exercising, to approach a sensitivity and awareness to look after themselves. My own father died, relatively young. He was in his 50s, not much older than I am now. And he had many, many years of chronic diabetes due to not looking after himself. And he didn't take insulin, and he didn't stop eating poorly. He didn't exercise, and he didn't stop drinking alcohol, and he didn't stop eating sugar or fried foods. He thought it was very funny. I mean, it was sort of like his thing. I remember going to get some kind of sausage, chili dog, chili and sausage, and near the end of his life. I had the coat for years where he wiped his mouth, and his wife gave me the coat, and there it was, all this chili on his, I didn't have it clean for a long time. And during the period when he was decaying on kidney dialysis and things like this, like many of you have stories, we lose people. I don't want to, it's not a special magic thing. I know it's part of our common humanity. But, he just couldn't get his mind around how to take care of himself. And he repeatedly, this is just sharing it, you could repeatedly actually died. And the doctors would say, you need to have this conversation because he's not going to make it, And then we would have this big emotional discussion where he would tell me, I'm sorry, I was a bad father. I, abused you, I was alcohol, whatever it is. And I'd be like, it's okay. And then, then 6 months, and then he wouldn't die, which was embarrassing for everyone concerned. So then 6 months later, they'd, oh, he's going to die, and he'd go through the same thing. But he was very strong-willed, and he just kept being alive, and they gradually removed parts of his, feet and all this stuff. So pardon this is triggering, but what would it have been like, what would it have been like if earlier in his life someone could have taught him to look after himself properly, the value of that, identified his blocks and his resistances, identified where he was psychologically inflexible, what pain or trauma he was self-medicating. That would have been pretty great, you know. Great for his daughter who was younger, great for us. And many of you have seen this happen. It's happened with your clients, it's happened with your loved ones. It could be anything from an addiction to, you know, diet, or just not taking medicine when somebody needs it. Or so compassion focused therapy, and I think that's one of the great, and ACT, and I think it's one of the greatest overlooked areas for psychotherapeutic intervention, is helping people to have healthy behaviors and to live more fully. So thank you for indulging me for a couple of minutes, you know, and telling you that personal story, but it does sort of flesh it out and breathe some life into the experience. So I appreciate you giving me the room to share that. What other questions might we have? And, you know, if there are any that are, you know, burning questions for you, these are awesome questions. So it's not a criticism, but we have this little time together. When are we done? Are we done in 5 minutes or something?
In 8 minutes, yes.
8 minutes. Okay.
Yeah.
In 8 minutes. So
6.
if there's something that is about what you're going through during this time, or one of your clients is going through, and you want to connect around it, feel free. If it's not that, that's fine. We'll have 8 minutes or 7.5 minutes of talking about a different thing. But I just want to leave it open for anything that might be particularly, you know, poignant for you in the moment.
Hay varias preguntas, pero me gustaría aprovechar para preguntar acerca de tu visión de la compasión y la justicia social en este momento de tanto sufrimiento y tantas desigualdades que la pandemia además muestra. ¿Cómo propondrías el trabajo de compasión en relación a la justicia social?
Well, take the time to understand the nature of the mind and the nature of the actual challenges that face us is what I would suggest humbly. My best guess or hypothesis is that we get drawn into competition and threat and feeling like someone on the other side is the bad guy. And, you know, sometimes they're bad guys. So I'm not saying let's be nice and not acknowledge evil, but let's fight it smart. Let's fight it intelligently, because this is a problem, at least since, you know, hunter-gathering societies became agrarian societies and then became civilizations. This is baked in to primate hierarchy behavior, despotic hierarchical behavior, and a human brain that is overcharged with competition and threat when it doesn't need to be. We have enough. We have enough resources. We have enough knowledge. And the problem is, and it happens to me all the time, some of you who know me on social media will know this, like, although not on Twitter, I play nice on Twitter. Like, it's so easy for me to think it's because of Trump or it's because of this person, and it makes me so angry. And I mean, I can't even take it. I think about what's happening to people. And yet that's not the point. That's not the point. And if I take that bait, then I'm something's lost. You know what I mean? Something's lost. If we move into not a competition or a fight, but a protect, nurture, if we find our strength in our love, we find our strength in our family nature, that we are family, that we are a human family, then we get stronger. Then we get stronger. That's, if we can embody it, and like on my website, on mindfulcompassion.com, and on the Compassionate Mind website, also there's a conference going on right now at compassionatemind.co.uk. Some of you know that. If you wanted to go there and, you know, register late and watch the videos, we could all like just descend on the conference and, you know, let's take it over. Like, it's, use the imagery practices that are on the websites, read some of the books, practice embodying that compassion, and then you bring it to what you're doing, like an actor. You know, you become that compassionate version of yourself. Like there was some tension on the ACT list recently, and I just talked to some people, just talked to them. But before I talked to them, I did my practice. I kind of come into how can I embody being strong, loving, compassionate presence. You know, it's all, don't have to be it all the time. You can be angry or frightened or, you know, yell at the dog or whatever it is. We can be our whole self, but practice being able to bring that online when you need it and then bring it into social justice. And I think then we're much more effective when we're in the fight, you know, we're much more effective when we're in the fight than when we're unbalanced, you know, which is so easy to get. That's not the whole story. There's no magic, but it's my best shot at answering that kind of question and answering the questions that are here and giving you whatever I have to offer. So I hope that there's something in it that is helpful to you, you know, and if not, well, I hope it was at least a good way to spend a little time and see your friends smiling, and we could be here together. Anything before we close? Manuela, do you think there's anything we should touch on before we conclude?
No, me di el gusto de hacer la pregunta. I did the question that I wanted.
Wonderful. Well, I'm glad to be able to answer.
Puedo ver mucha desigualdad y cómo desde la compasión verdaderamente aproximarse a eso es algo que me convoca.
It's our humanity. So before closing, I would just invite you to do just 2 minutes, right? So like, I would like you to think about your life and your career and your mission. And I would like you to think about how meaningful it would be to just help one human being. Just one human being whose life is as important as my life, as your life, as my daughter's life, as my wife's life. And even if we just help one person to live a life of meaning and purpose, and that we've done something amazing, we've done something really worth it. And I want you to recognize that you've helped many, many more people than just one person, like many, many more people. And those people have been more healthy and more caring, and they've affected the lives of people around you. So I want you to just be grateful for who you are, particularly this year. I want to invite you, or even dare you this week, when you're feeling down or when you're feeling stuck, take a moment and breathe in a sense of gratitude for who you are and for what you've given the world. And I'm grateful for you and for what you do. So thank you for giving me the honor of spending time with you. It means a lot to me. Thanks a lot.
Gracias, Dennis. Thank you. Thank you very much.
Thank you.
Yeah.
Okay. So see you down the road then. Okay.
Gracias, gracias a todos y a todas los que participaron. Verdaderamente nos quedamos con estas palabras de gracias por ser quienes somos. Gracias, Dennis, por ser quien sos.
Thanks again. Okay. Farewell. Bye.
Chao a todos. Nos volveremos a ver, esperamos en otro encuentro. Le agradecemos de nuevo mucho a Dennis y a cada uno de ustedes por estar aquí en este encuentro.
Gracias.
Muchas gracias.
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 Gracias, Paula.
Gracias,
Manu.
Gracias. Muchas gracias.
Bye.
Muchas gracias.